So this week on Big Brother Chris, I'm going to be covering a topic that I think a lot of people have questions about. It's something maybe I should have covered in one of my earlier on videos because it's kind of like transitioning 101. But I'm going to be covering the effects of testosterone as you transition. Testosterone, or as a lot of people call it, T for short, has a lot of effects, and they vary from individual to individual, and they will happen over time, and they may continue to happen. And I'm just going to talk a little bit about what you can expect regarding the effects of testosterone in hormone replacement therapy. First and foremost, you need to know that testosterone is not for everybody, but for those who choose to take testosterone as part of their transition process. There are several ways that testosterone can be administered. The most common way is through injections. Those can be either intramuscular into your muscle or subcutaneous, which will be into a fatty area, either like your stomach or your hips. I only have experience with intramuscular injections in both my thigh and my ass. So intramuscular is known to be slightly more painful than subcutaneous, but I don't think that it's that painful. It goes into big areas of muscle. It's a really common area for injections, and it's really manageable. But if you have a fear of needles, subcutaneous might be a little bit better option for you because the needle is smaller, and for many people say that it's a less noticeable twinge of pain during the injection. There is also topical testosterone, either in patches or gels or creams. That's a little bit less common. And then there's also pellets that can be injected under the skin. The delivery method that you use is going to depend on where you live, what your doctor prescribes, what you prefer as a patient, what your insurance may cover, the cost, health risks and benefits for you as an individual, etc. So there are a lot of things that go into what kind of testosterone you might be taking and how you're going to be giving it to yourself. And just like a quick overview, injectable testosterone is usually injected between once a week to once every 3 weeks. That's the average. And then topical testosterone is usually applied daily. The pellets that are put under your skin, to my knowledge, are injected every few months. Most of the changes that you're going to experience will happen in the first 2 years or so, but some may continue to happen, and we're going to talk about the changes when you can expect them to happen, though that varies from person to person, and what is permanent and what might change if you decide one day that testosterone isn't for you, or just to stop testosterone and continue with your transition without hormones. Regarding changes on testosterone, these effects may take several weeks, months, years to take place. They may never happen. They may ebb and flow. Your effects might take much longer or much quicker than people you know or people you've seen. Don't worry about it. Every person is different. It all depends on how your body metabolizes testosterone. It depends on your genetic predisposition. It depends on how often you take testosterone and your dose. Many different things factor in. The biggest, I would say, though, is genetic predisposition, especially to things like body hair and facial hair, etc. But we will get to that. A deeper voice is one of the first things that people hope for and want, so your vocal cords will thicken and your voice will drop. Usually this is going to happen in increments. Your voice is going to crack for several months. You may notice several distinct drops over time, and most people say that their voice levels out after about a year or so, but some people's continues to change. I would say that you'll start noticing a voice drop around 2 to 3 months. That's where most people experience it. Some people notice earlier on. I think my voice noticeably started to change around 3 months. The next change you can look for is facial hair growth. Now this varies greatly from person to person, and this is one of those things that's really dependent on your genetic predisposition. And you know, some cisgender men never get facial hair or have very minimal facial hair. That's not a thing that's only specific to trans men, so just keep that in mind. But facial hair, for some, it might happen early on. I know some people who start noticing a mustache and chin strap and all sorts of sideburns coming in around like as early as 6 months. And for some people, it's a better bet to say that around like a year-ish is when like your facial hair will probably start to like really blossom. Increased body hair growth is one of the next changes you might notice. You'll probably notice it's starting to happen around 3 to 4 months. Some people are hairier pre-T than others, and so that's going to be a really big factor in how much body hair growth you have. Your genetic predisposition to body hair in your family is going to play a huge role in this. Probably around 3 to 4 months is when you'll start to notice that kicking in, and it's just going to continue to happen. My legs got hairier first, and then I would say around 6 to 8 months I started to notice more of a coarse, dark, happy trail coming in, that sort of stuff. Some people are going to notice hair growing in more masculine places, so on your chest, your back, your shoulders. You're going to maybe notice more arm hair growth. I've had a little bit of hair growing on my hands that I never had before, so things like that. Now, a change that I think maybe some people are not really aware of, or maybe don't know a lot about, is a change that I was like really wary of, and I think that like people think of testosterone and they think, oh, body hair and muscles and voice deepening, but they don't necessarily think about what's going to happen to your anatomy, and by that I mean your downstairs, your genitals. And I'm going to keep this pretty PG and whatnot, but I think it's important for people who are unaware of this change, or parents, or whoever that's watching this, to know that testosterone more than likely will affect what's happening down below. And for many, we call this bottom growth, or it's going to cause the clitoris to enlarge. A lot of trans women don't really identify with the term clitoris, but just for anatomical purposes, it will enlarge, and that's going to be one of the very first changes that you will experience. Now, it may vary from person to person, and I guess I can't say it's guaranteed that you will experience this change, but from most of the trans men I know, they have noticed at least some growth. It will vary from person to person. It could be very slight, minimal millimeters to just a few centimeters to several inches. It really just depends. It depends on what you had going on down there before, as well as just how your body reacts to testosterone. So you will notice some lengthening and thickening of your bottom genital area of your genitals. That probably will be one of the first changes you notice. For me, it was noticeable within 2 weeks, and at first it's going to be uncomfortable. I wouldn't say painful, but it's just almost like you're constantly too stimulated, and you might not be able to cross your legs, or you might have to wear looser boxers or something. You're not gonna grow a dick out of nowhere. Like, I'm sorry if that's what you're hoping for. You're not gonna grow a cisgender male phallus. You're just not going to. And it's not going to happen overnight. Don't worry about that. It will be gradual, but you will notice it. It might be uncomfortable, and I need to let you know that it will pass. It will eventually not be as sensitive and uncomfortable, and I think that's important to tell people, because I didn't know it was going to feel like that, and though it wasn't excruciating, it was a little bit surprising, and I had to reach out to some of my friends and say, when is this going to stop? And it does lessen over time, so just keep that in mind. Another change you can expect on testosterone is that your period or your menstruation is going to stop. Now, this varies greatly from person to person on when it does happen. It's going to depend on how often you had your period before testosterone. It's going to also depend on your body type, how you metabolize testosterone, whether your period is affected by stress, and all sorts of stuff. So just keep in mind, for some people, your period will stop as soon as your first shot. That's what happened for me. For some people, it may take months. For some people, they still experience spotting here and there throughout their transition. This is a good indicator for where your levels are at for your hormones. So if you do experience spotting, that's something you can tell your doctor about while you're on testosterone, and see if maybe your hormone levels need checked, your blood levels and whatnot, and see if maybe you need to change your dose and adjust it so that maybe that menstruation will cease entirely. But keep in mind, that is a change that does vary really widely from trans guy to the next trans guy. So yeah, you can expect it as early as the first shot, or it could take months. But testosterone will stop your period from happening. A potential change that could happen, and this is just a possibility, doesn't happen to everybody, just the same way it happens to cisgender men, is male pattern baldness may affect you. And this change, more than likely, if it's going to affect you, will take at least a year or several years to come into effect. This is something that is going to be greatly influenced by the patterns in your families. Another change that's going to happen is that your body fat is going to redistribute into a more masculine pattern. Now that means it's probably your body fat will move from places like your hips and your thighs to probably your abdomen area, because that's a more masculine place for the body to store fat. This can start as early as a few months and will continue as you're on testosterone. Your body is now placing fat into a more masculine pattern. Additionally, in the same vein as this, your body might start to show a different muscle tone, but the biggest factor in muscle tone change is also going to be how active you are. Some people might see some serious muscle changes and gains on testosterone without working out, but that usually happens if you have a very, very low body fat to begin with. Usually you will see a different amount of progress in your muscles than you did pre-testosterone if you work out, but that's not something that you're not going to just sprout abs overnight, and that's not something you should expect, but it is something that if you are interested in fitness, you should know that it might be easier to see some progress because your body's going to build muscle in a more traditionally masculine way. An effect that doesn't necessarily happen to everybody, but is something that you should keep in mind. Testosterone could make your skin more oily and could lead to acne. Basically, this is what a lot of people call second puberty. Your hormones are going crazy. So for me, luckily, I haven't experienced basically any oily skin or acne on my face. I have experienced some on my body during my transition thus far, but as a teenager I had pretty bad acne, so it's not always indicative if you had acne growing up if you're going to have any while on testosterone. But for me, I've just found that if I'm very proactive and I make sure I just wash my face a lot, I've just been able to stay ahead of the curve, and it really helps. But for some people, it's not going to matter what you do to prevent it. This is a factor that really might affect some of you. So keep in mind that if you do experience a lot of skin problems, it might be indicative of whether or not your dose is too high or too low. It also might just be something that your body, that's how your body reacts to testosterone, and there are things that doctors can prescribe to help you with your skin if you get to the point where you have like cystic acne. It's definitely something that can be resolved, so don't worry if it's something that happens. And also, acne is one of those changes that, yeah, it can start as early as a few months, but your skin is going to ebb and flow with you depending on your diet and your hormone levels and your activity and your cleanliness. So just because maybe you have some skin problems early on, it might subside as your transition continues. You might also notice that your body odor is going to change. This is just something that varies from person to person. You might notice it as early as a few months on T. Definitely I noticed that I'm a little stinkier after the gym, and just my general body odor has changed, but for some people it might be minimal, and for some it might change a lot, so that's just something to keep in mind. You might notice an increase in sex drive. Testosterone plays a big role in libido, so you might notice that your sex drive goes up. For some people it really does, for some it doesn't. Now those are all of the changes that are basically to be expected, and that most doctors will let you know about. I don't necessarily know the right way to word this next part, but these are changes that are not necessarily medically documented symptoms or changes or effects of testosterone, but things that I have read and know are reported changes experienced by a lot of trans men. So you're probably going to notice that your face is going to seem to look more angular or more masculine. Your bones don't change. Your facial structure cannot change. Your jaw, your skull is not going to change. The fat on top of your jaw can change, so that redistribution of the fat throughout your body also is going to affect your face. So you might notice your jawline is going to come out a little bit more. Another change that doesn't happen to every person but some people experience, you might get an Adam's apple. That thickening of the vocal cords really leads to a more prominent and visible Adam's apple, but this is dependent on person to person, just the same way that some cis men have very visible Adam's apples and some don't. Some people experience an increase in energy. Additionally, you're going to more than likely experience an increase in appetite. Now, this varies a lot person to person, and there is no scale to say what is hungry from one person to another, but it is incredibly likely that testosterone will make you hungrier than you were. And I noticed that myself very early on, maybe the first month or so. A lot of people are under the misconception that testosterone will make your breasts go away. It is possible that T will change the density of your chest. It can also help shrink your chest, but a lot of that is dependent on your chest size before testosterone, your activity level, your body fat percentage, and just not something that can be expected to happen. What's more important in that is how your body is made up, what your chest looks like already, and your fitness level and how much you can hit your chest. It can really help decrease the fatty tissue in your chest, but if you had a large chest to begin with, the only way you're really going to get rid of a lot of that excess tissue or skin is via top surgery. So just don't expect that you're gonna start testosterone and then get pecs. Some people can work out their chest to a point where it's passably cis looking without surgery, but that's very rare. And lastly, but pretty importantly, there's this misconception that testosterone is going to change you as a person. It's going to make you angry. It's going to give you the short fuse. Testosterone does cause some emotional changes, but it's not going to change you innately as a person. You're going to be the same person. For me, I noticed that testosterone really leveled me out. It kind of eased some of my anxiety. It made me a little bit calmer of a person. Yeah, sometimes I feel like my fuse is a little quicker than it used to be, but I also feel like it's just a personality thing for me. I feel like people of all genders and hormone makeups have different types of personalities. So you may experience some emotional changes, but they are not always for the worse, and you will not become necessarily this violent, angry person that there's this misconception with testosterone. No, it will not magically make you a different person. You can't expect testosterone to alleviate your dysphoria entirely, but it is definitely a tool that can help. It can help you change your body in a way that you might prefer, and it can help you emotionally and mentally maybe become or move toward the person you want to be. But it is not a cure-all drug, and it will not change you into something that you're not, so keep that in mind. Don't take this advice as anything greater than what a doctor will tell you. Absolutely still talk to a doctor, still talk to medical professionals, but this is a good, it's good to know what you're getting into, and I'm glad to be able to tell you what you can expect. Yeah, if you have any questions, you can be sure to comment below if you want to show this to anybody that's needing just a quick idea of what you can and can't expect. This is just one trans person's experience, and also based on research and people that I know and things that I've read and things that doctors have told me. But again, always listen to your doctors first. Thanks so much for watching. I hope this was helpful, and we'll see you next time.